I say hello, my name is Kath Evans. I'm a children's nurse by background, and I work as Director of Nursing for Children's Services at the Royal London and WIPS and Newham and Community Services for Tower Hamlets, so all part of the Barts Health group. But I've also got the privilege of actually being the clinical lead for our Babies, Children and Young People programme at North East London Emerging Integrated Care System. And I've got a real passion for youth voice and participation and engagement in relation to babies, children and young people, and also a real commitment to ensuring that they're represented in our plans actually going forward. So I believe that's why I've been invited here to join you. One of the things that we've been doing from a child health perspective, particularly during the pandemic, is actually coming together as a community of practitioners to collaborate and to talk and to support each other with the challenges of making sure that the population group, 30% of our population, babies, children, young people, are actually considered in planning going forward, and that they aren't forgotten, which often feels as though that can be the way. There's a lovely African proverb that says it to raise a child, and I wanted to almost sort of, swap the village for a system, but the system doesn't quite sound take a community to actually raise a child. And one of the elements that I was involved in a previous role was actually establishing the NHS Youth Forum, and we recruited 25 young people from across the country to challenge us and to hold us to account at NHS England with regard to the policies that were being developed and delivered in relation to this population group. And what was so wonderful was through that model of participation and engagement was like, but not only flourished personally, but the networks that they actually grew and connected with. And they kept us focused on what mattered most to them. And they drove forward a number of programmes of work that sort of, really did sort of, matter. So they highlighted how it felt to have a long-term condition and to actually be in school. And what they wanted to do was actually coordinate a programme of educating the educators. So how did they actually share with teachers what it actually felt like to have a long-term condition, to be challenged with regard to absences, and how to actually address it. So all of that work is available on the British Youth Council website, and it was amazing because it grew legs and it really ran because the young people actually disseminated it and they shared it. And they also did a really lovely campaign around youth rights in healthcare, and how they could have their voice heard, how they could actually strengthen that voice. Interestingly, when we've actually looked at some national surveys asking children and young people about their experiences, 43% of them say that they don't feel involved in decisions about their care. So one of our ongoing pieces of work is actually going to be to actually work with young people to say, how do we shift that? How can they guide us to actually create greater involvement and to really grow that self-advocacy? And we really feel that they will absolutely lead the way. So we're delighted to actually have a session planned with a whole variety of different groups, including Barnardos. I'm not entirely sure as to whether Barnardos are still with us to actually explore that further at Health Spot, which is over in Limehouse, which provides an amazing primary care health facility working in collaboration with mental health, with sexual health, supported by youth workers as well. And the feedback that we actually get with regard to that youth-centred offer that is very much led and co-created thanks to Helen Jones and Julia Moody, just inspirational GPs, is just absolutely fantastic. So we've been able to grow that sort of, opportunity for youth voice, based on that work. But now what's really lovely is that Stratford Youth Zone have actually looked at the Tower Hamlets youth-centred primary care services and said, is there something that we can actually be doing? So we've engaged our local authority partners and primary care colleagues to actually think about how do we actually create that youth-focused primary care offer within a Stratford setting alongside mental health and sexual health. So it's really great to actually see these conversations now really beginning to actually emerge as we actually move forward, so that we can co-create services. The other element that we've been doing across North East London is thinking about social prescribing and what that means for babies, children and young people. Family Action have done some lovely work in City and Hackney around this, and actually testing models of engagement, which is really, really fantastic. And we've got some lovely co-created models of social prescribing for and with young people as well, really bringing together sort of holistic needs. We've just gone to Bart's Health Charity to actually fund a secondary care based social prescriber for and with our children and young people with medically unexplained presentations, to see as to whether we can offer greater time to have conversations around what matters most to them, and then support into appropriate activity and that ongoing connection as well. And I can see that the wonderful Susie Minson, who's a paediatrician over at the Royal London, has just popped on her camera actually, and Susie is an amazing champion for adolescent care, but is also a lecturer at QMUL as well, so really working with the next generation to help ensure that we actually get care as good as it possibly can be for and with our young people as well. The other element that I just wanted to flag very briefly was young people are huge assets and they're hugely energising, and it's always a real privilege to actually work. Energizing it can be to work with patients in different ways. Actually, young people are just superb, and I got that vibe from Caitlin, actually, Jonathan, when she was speaking with you earlier, that sort of, there was a real connection there, which is really great. Waltham Forest Public Health team have worked with the Royal Society of Public Health and schools to offer an opportunity for young people to actually gain a qualification and become a health champion, and 400 young people have actually taken up that opportunity. So those young people are focusing on things that matter most to them, and mental health and relationships were key elements that they actually wanted to explore. And those young people now are amazing ambassadors within their local homes, within their schools, within their communities, to really co-create health as we move forward. And I just wonder what greater opportunities we've actually got to make sure that we are working with our young people as we actually go forward. They're going to be the parents of the future. It's been a great privilege actually working with care experienced young people recently to actually find out what matters most to them, and elements such as access to prescriptions has been a real challenge, particularly for those that earn slightly over the £15,000 where they're entitled to free prescriptions. And what we're really aiming to do across London is create a compact, a covenant with our young people who are care experienced, to provide them with access to prescriptions if they actually need it, swifter access to mental health services, access to leisure facilities, but also, as was referred to earlier, supported access to employment across health and social care as well. So really keeping the focus on our most vulnerable young people going forward.